Dr. Lucas is with us from Diabetes Endocrinology Consultants. Good morning, doctor. How are you?
Good morning. I'm great.
So I understand you were just back from Miami. How was Miami?
Hot.
Hot? See, I knew
Very hot.
we have a chance to brag a little bit.
It was nice coming up here to the far north from Miami and having a nice weather.
All right. So what are we talking about today?
We're going to talk about research studies. September is a good month to start a research study. It's before the holidays. Get your diabetes in control before you pig out, or Thanksgiving. And usually January is another good month to start into a research study. But we have a bunch of studies starting in the next month or two. Some are started now that people should be aware of in case they want to call, see if they qualify.
Okay. All right. What kind of studies are out there?
Well, it's diabetes studies and type 1 studies. Type 1 are the people that take insulin from the start of their diabetes, so they don't make insulin. They're using oral agents with insulin for diabetes, and these are the SGLT2 drugs. These are Invokana, Farxiga, and Jardiance. So one of them is using Jardiance in type 1. These drugs pull sugar out of your body. So
now, are they normally type 2 drugs? But they're being
yeah, they've been
for
approved
type 1?
only for type 2. So this is different. This is type 1. They've not been approved for that, but they are out on the market. They've been out for a little bit over a year. Jardiance has been out at the same time. They got all 3 approved about the same time. And what they do is the kidney normally holds on to sugar. The kidney's function is to hold on to good things and get rid of bad things. So it holds on to sugar and protein and puts it back in the blood.
Right.
And gets rid of waste products. So if you have diabetes, you don't really want it to hold on to sugar. You've got enough sugar floating around. You don't need more. So the kidney, there's one protein in the kidney that holds on to sugar. That's all it does. And these drugs block that protein. So the kidney doesn't care if you're type 1 or type 2 because it does the same thing for everybody.
Right.
So the idea was, well, if you have these for type 2, that's good, but maybe they would help type 1 because type 1s have trouble getting their sugar perfectly controlled because insulin takes a while to work. You take the insulin before you eat. The sugar still goes up after eating no matter what you do because the insulin, there's a delay in absorption of insulin. Even though they keep making quicker and quicker insulins, it's still not right. So these drugs pull excess sugar out of the body. You would have to adjust your insulin and make sure that you didn't have a low blood sugar because of it. But it's very interesting. So we have 2 different compounds. We have Jardiance, which has already been approved, and there's one that's not been approved yet, and they're only trying to get approved for type 1. So it's a special type of the same kind of drug. So if you have type 1 diabetes, that means you're on insulin. You can be on an insulin pump, but you're only on insulin. Then that study, you might be interested in that. It has an advantage of losing weight too. So people that have type 1 that gain weight because they're on too much insulin or not the right amount of insulin, or they're hungry because they're having to take insulin would be appropriate for this since it helps you lose weight. You're losing calories out of your body, because sugars are calories.
Now, I remember growing up with the type, well, it was called juvenile diabetes then, and they were largely skinny guys that had it.
Yeah, the insulin wasn't as good. Now the insulin's really good, and we got a lot more food to eat.
A lot more drive-thrus.
A lot more eating out, and the insulins are better because you have the long-acting and the short-actings, and they're real short-acting, but they're not short-acting enough. So you tend to overdose on insulin. Insulin makes you hungry. So a lot of people have gained weight, especially when they've been trying to get really well controlled during pregnancy. A lot of the women pick up a lot of weight during that time because they're trying to have perfect blood sugars for the baby, which is a good goal.
Right.
But they tend to not adjust their food and just take more insulin. So if you take a lot of insulin and you don't adjust your food, you're going to gain weight, and that's pretty common thing now. The only people that are skinny now with type 1, or a lot of people that are skinny now, either are the people that are way out of control, so they're losing sugar out of their urine anyway, and that's not a good person to put in one of these studies because they're already losing sugar, or the people that are just like marathon runners, or the people that exercise a lot, that are really into that, and they keep their sugar very well controlled.
Okay, so again, in studies, you are looking for people who are not well controlled, and that's the obvious
Yes,
part.
if they're too well controlled, they don't really want them in a study because they want to show that their drug is really good. So they actually don't mind if your sugar's out of control because the studies put you in the study before you start the drug for 2 or 3 months and try to get your sugar better controlled.
Okay.
Before they start the drug. Because if you start the drug when your sugar's way out of control, like I said, you'll have more symptoms. You'll be more thirsty, urinating more because you're having more sugar pouring out of your body. So they give you some time that you adjust the insulin, make people check their sugar more often. It's a way of getting the type 1 controlled. One study even kicks you out if you get too well controlled.
Okay.
But they don't mind if you're out of control at first. When you first get signed up for the study, that's the study that's already started. That's the Jardiance study. So they want your A1C to come down. They want your sugars to be better so that you won't have as many side effects when you start the medicine.
Now, again, for the type 1 studies, are they, do you do studies with children?
No, you have to be 18 or over.
Okay, all right. So
And you can't be too skinny.
So it may have been a late diagnosis for some people, right?
Well, you don't have to be just diagnosed. I mean, you could have had diabetes a while. But you have to be in a study. This is not a pediatric study, so this is an adult study. And you have to be 18 years or older.
Do you ever do pediatric studies?
I haven't.
Yeah, I wonder about that.
It's harder.
Yeah.
Informed consent is difficult.
But yes, that's true. But the advantages of doing a study are many for the participants.
Yes, especially type 1, which they need to check their blood sugar more often anyway. And if they're in a study that's making them do it, they're more compliant. They actually are forced to do it, or they get kicked out of the study if they don't check their blood sugar 4 times a day. So that's always a good thing for them to do.
Okay, and now how do people find out about the studies that you're currently
They can
running?
call our office, 222-5700-252, or they can go on the website, send us an email about the studies.
And that's beachdoctor.com. Now, do you do multiple studies at the same time?
Yes, we have several studies. So that's the type 1 studies we have now. We don't really have an insulin study for type 1 right now, but that's in the future probably that we'll get one of those. We've had those in the past, and they're very helpful for people to get controlled. We have a lot of type 2 studies. We have type 2 studies for people that have had any kind of heart problem, like heart attacks, strokes, any kind of vascular problem. All the diabetes drugs and weight loss drugs have to go through a long-term cardiovascular outcome study, which just means that you have to put them on the drug and leave them on it for five years and make sure that the drug doesn't cause heart problems.
Okay. All right. And we're talking about this with Dr. K.G. Lucas from Diabetes and Endocrinology Consultants. If you would like to call in a question, you can do so now.
You can call me at 800-818-2255 or use one of our local numbers, 247-7282 or 353-4674.
With all these studies that are going on, I know that often it's a period of time between the end of a study and it showing up or getting the FDA approval. Do you track whether or not these studies have led to anything?
Oh yeah, a lot of the studies we've done have led to medications that are out now. It's very rewarding to see your drug finally get approved. Sometimes it takes 5 years or 6 years after you've done the study to get it approved. But yeah, most of the studies that we've done, the drugs have been approved. Because it's phase 3, by the time it hits phase 3, they pretty much are sure what's going on with it.
You're like the icing on the cake for the study, right?
They just want more people to be on the drug before the FDA approves
Although
it.
icing and cake are probably not good terms to use there, right?
No, it's hard to get sugar-free icing.
That's right. Coming up in a moment, we'll talk a little bit about Diabetes School that's coming up too, and a reminder how you can be part of that. That's here on Coastal Daybreak. And Sugar Talk with Dr. K.G. Lucas from Diabetes and Endocrinology Consultants. You can find them online at beachdoctor.com. Back to the program here with Sugar Talk with Dr. K.G. Lucas from Diabetes and Endocrinology Consultants. And you have a diabetes school coming up not too long.
Yes, Diabetes School is coming up October 10th at the History Place, 8:30 to 12. I talk about diabetes. We have a dietitian that comes and tells you about food. Most people are interested in that, and we even have food at the break.
Right.
But
healthy snacks.
It's a way of sort of concentrating on learning about diabetes. I think we get information in little piecemeal things, especially looking at websites and ADA websites. You get little snippets of information, and this is one way of asking questions about the information or clarifying something particular for you. It's a more personalized class, and so you can go to the website, click on Diabetes School, sign up. It's free.
So go to beachdoctor.com and you can find it there on the homepage.
Yes.
You can find that.
So we don't charge for that. It's community service. but a lot of people have been there several times, and I think you learn something each time you go.
Mm-hmm. And then if you want to find out more about the studies, you can click on the
Clinical
studies.
Research tab on the website beachdoctor.com or call the office.
Okay. And now for the diabetes school, do people need to sign up ahead of time for that?
It'd be nice. The room only holds so many people, and we like to keep an eye out on how many people are coming.
And you often have a full crowd for that.
Yeah, we've had 60 to 80 people come. You never know who's going to come. It depends on the weather. So if it's bad weather, they're more likely to come. But anyway, we're looking forward to it.
Again, diabetes school, and it takes place at the History Place in downtown Morehead City, right?
Yes, and then we have another announcement we're going to make in November, but we'll have to wait and see about that. We just a little teaser there.
Okay, a teaser
for our next project.
All right. But there's a lot that's going on in the website. Again, at beachdoctor.com is a good focal point to find all these
yes,
things, right?
I think that's an easy way to remember that. It's not a weird name. It's, Beach Doctor, one word.
Yeah, and that's where you are. So this is good. Now, with the studies, how many people are you recruiting now? Do you have an idea?
Usually try to get between 10 to 30 people in each study. It depends on the type of study and how many people we can get to fit the criteria. We also have some other type 2 studies that I didn't mention, but if people are just on metformin or just on 1 or 2 medications for diabetes, they might find
Go
something
online
for
and find
them.
out at beachdoctor.com. Sugar Talk with Diabetes Endocrinology Consultants.